welcome back to Fluency and Focus Episode 5, the podcast where we talk about language, life, and learning.
Today's episode takes us beyond the classroom and into the world of international internships. What is it like to leave home, adapt to a new culture, and work in a hospital in another country?
To find out, we are joined by two dietetic students from Malaysia who are currently completing their internship placement at Pattani Hospital.
We'll be talking about their experiences, challenges, cultural discoveries, and what they have learned along the way.
So let's get started to hear their story.
Let's go.
Assalamualaikum.
Waalaikumsalam.
Hello. Can you introduce yourself, please?
Yes, sure. Assalamualaikum and a very good evening to all the fellow listeners out there. My name is Sofiy Rahmat, but everyone just calls me Sophie. I am from Perak, Malaysia.
So how about you?
Yeah. I am Sofiy Ep.5 and I am a fourth year or final year dietetic student from University of Science Malaysia, and I stay in Malacca.
I know that both of you are studying in Kota Baru, right? So I thought you are originally from Kota Baru. No.
We are both what we considered as outsiders outside from Kelantan, but so we have to learn how to speak with their dialect. So it's very different from Central Malaysia how
Yeah.
we speak.
Okay.
But here in the east coast of Malaysia and the southern of Thailand, the dialect is almost the same.
Why did you choose dietetics as your field of study?
My story is not going to sound very noble, but at first, ever since I was a kid, I've always known that I wanted to get into healthcare because I've always been drawn to biology subject. So yes, it's definitely a healthcare for me, but then I didn't want to be a doctor because of the long hours and I don't want to work shifts.
Okay.
So the obvious choice for me was allied health. So over time, we got introduced to a lot of different allied health careers. So eventually, I think dietetics is the most interesting. So that's why I chose this path.
Okay.
Now Saf, so
Okay. Actually, I'm interested in dietetics in how it's actually food really helps in human well-being, and also as we know that food is essential and everyone is eating every day. So I'm curious how this food can cause to the diseases. The curiosity lead me to here.
Wow.
Is it true that all dietetic students keep themselves healthy?
The tricky one.
I am the outsider. I think, although at the risk of sounding hypocritical, I don't think we follow all the guidelines and all the practices that we preach down to a T. But we do try to get in some exercise. We try to get more fibers in our daily life, right?
Yeah. Over the time, we try to learn and practice it in a healthy
Same time.
lifestyle.
Because we are also human, right? Sometimes we need sweet as well. We need drink, right? Yeah.
When you first heard about in the internship in Pattani, Thailand, why did you choose to come here?
At first, we were selected and
Okay.
recommended this in Thailand internship by our lecturers. I relate back to the main reasons that we are here, that we would love to learn new settings regarding the clinical setting practice here for case management, types of common cases, the referral system, ONS management, as well as the blenderized diet given, that we actually eager to learn more about that.
Okay. Okay. All right.
I completely agree with stuff. And basically, what we want to learn here is, since we all have the basic principle of medical nutrition therapy, it's how you treat the patients with food. So we want to see what is the difference in terms of practice. Because if we focus on only the MNT, then it's almost the same across the countries. But the practices and the advice might be different. So the difference is what we want to learn.
I see.
And what did you find out?
In general, I think not that much different, but it really depends on the dietitian's style and also the types of patient that comes, whether they are a compliant patient or non-compliant, because those two categories are very different in how you approach the cases and how you counseling them for them to actually follow through the advice. And we found that some of the differences, like first the case referral here, in regards of the difference between the hospital that we practice in Malaysia, which is a teaching hospital, and here, which is a government hospital, case referral are heavily dependent on whether the doctors are referred to the dietitian. Because back in Malaysia, we are used to like screening everyone and then choose the patients that you want to assess.
Okay. What were your first impression of Pattani and Pattani Hospital?
Our first impression when we come to Patani is actually the people itself. We were surprised with how nice people are here, how helpful they are when we are here. Especially our friends who help us through and through.
Yes. Shout out.
Shout out to
Afni, Asma, and Khadija. They
Okay.
are very, very nice
Your
people.
students?
Yes, students.
They are third year and GPSU students. They pick us up and then send us to the hospital every single day.
So that's how you commute.
Yes, that's how we commute, and that is for us. That is a very huge favor, because back in Malaysia, we like to help people, but maybe not to that extent.
I think we were blessed in every steps we are going because everywhere we went to, everyone is very helpful.
Okay, now we're going to talk about. Can you tell me what a typical day look like for our dietetics? As I am not relating to this field.
So basically, we have two settings: outpatient, which means that the patient comes to the clinic for a sort of like a walk-in counseling session. But then their cases also referred by the doctors at the Patani hospital. And then the second setting is inpatient, where we go up to the wards and see the cases that has been referred, the patient that has been referred. And for the outpatient settings, usually you have to assess, for all the patients actually, you have to assess what we call the ABCD components, which is the anthropometric, which consists of their weight, their height, their ideal body weight, and then you move on to their biochemical data, whether there's any abnormalities. Usually we could see that sometimes in CKD cases, their sodium, potassium, and phosphate profile is going to be a little bit of haywire. Some might go up, some is too low. So those are some of the electrolytes that you have to look for and tackle using the food and advice that you have to give. And then the C component is clinical, where we included the nutrition focus physical examination, the NFPE, where you have to see physically whether they have muscle loss or fat loss. Usually in the temporal orbital area, the clavicle here in the collarbones. So what you want to see is either it is sunken or is it like normal, like a normal shape, on a normal healthy adult. And then for the D, it's the dietary, which is arguably the most important parts of our job, where we assess what they eat in a day in a usual pattern. So from there, from all those four components, we could summarize and then decide what advice is much suitable for them to give to them at that point.
And all of these is done are done in Patani Malay or which language?
Usually, if the patient can speak Patani Malay, we could do the assessment part, and then but the intervention part, like what advice would you want to give the patient, the dietitian is going to handle that part.
Now I learned something ABCD.
Okay.
Assessment.
Actually, we have the name of it, like the whole story, the whole we call NCP. What is that?
It is a nutrition care process, which
Yeah.
consists of NA, nutrition assessment, which she has elaborated just now, the ABCD component. The second one is the nutrition diagnosis, which we have to find out what is the problem from the nutrition intake or the clinical or either from the behavior. And the I is the intervention that she mentioned just now regarding the advices that we have to give to the patients. And the MNE is the monitoring and evaluation. for the further follow-up to see if the patient is complying with our dietary advice or not.
That's the dietitian heart.
Wow.
I'm
lost.
I hope you can see the big picture of how we
This
are.
is universal.
Yes, universal. Okay.
True.
Have you learned any Thai words?
Obviously, we use Sawadika, Kopunka,
My highlight.
and a lot of food phrases like
ไข่ทอดไข่นมปัง
and then
ข้าวแนวหม่ำ
the important ones when we want to order. But the pronunciation might be a little bit funny. So we apologize for that. It still works.
We can understand.
This is understandable. Will you recommend this to your juniors having a placement here?
That is something that I can answer confidently. 100%.
really?
100%
Go for
yes.
it.
Yes.
recommended.
Because I think that when you go out of your, universities, out of your comfort zone, you will learn a lot more. So, like the famous phrasing said, do it scared, do it nervous. Like, there's a lot of people lining up to be in your position now. So, like, when you are selected, might as well you grab the chance and, learn more. And when you go out of your universities, comfort zone and settings and whatsoever, you will learn not only regarding your careers, you will learn all the cultures, all the norms, and you could see like your career path. You could see how a dietitian works through a different perspective and how they apply their knowledge in the everyday setting.
In my opinion, it is a golden opportunity because the opportunity only comes once. So you have to grab this opportunity to learn something new, as well as it cannot be obtained in the classroom. And sometimes it can be learned from the most informal way. So I think you must embrace the differences as well.
Okay,
Wow.
thank you.
What is one thing you will miss after you leave Thailand?
I think this is a very obvious answer. I think the food and the people as well. Because like Sophia mentioned just now, the people is very amazing here. We had a lot of help. We have a lot of guidance, not only from the professionals, the ajans, the dietitians and nutritionists, but also even like we said, the strangers. They are very willing to help us in any type of situation. So we feel very welcomed. We feel in a way, very loved here.
Okay.
And we also appreciate that everyone is trying to communicate with us, even though obviously there's a very huge language barrier. But seeing everyone trying, it made us very, grateful to be here.
Good to hear that you're enjoying your time here in Pattani. Okay, we've learned that an international internship here is not just about gaining professional experience, but also about adapting yourself in a new environment and building connection across culture.
Yes.
So, a big thank you to our guests for sharing their experience as dietetics intern at Pattani Hospital. We wish you all the best in your future career.
And thank you so much for inviting us and having us for
Till
today.
then, stay strong, stay focused, and keep flowing. Bye!